I found it incredibly difficult to select something to put within 5 minutes, and this was such a diverse audience. So I just, not randomly, but kind of picked something which I hope you will find interesting and at least a little bit breathtaking, because that's the topic of this presentation. So I have a respiratory background, diseases such as asthma or chronic obstructive pulmonary diseases, and the cardinal symptom of these diseases is dyspnea or breathlessness, also termed air hunger or suffocation. And usually this is experienced by these patients as highly aversive, so very threatening bodily signal, which is very often the course why they seek treatment at all. Interestingly, it's not only a cardinal symptom in respiratory diseases, but also in other somatic diseases, neuromuscular, cardiovascular diseases, and so on. But interestingly, also for this workshop in psychological disorders. So many patients with anxiety disorders, psychosomatic complaints, they also report high levels of dyspnea and also experience that as aversive. Of note, psychological disorders or comorbid symptoms are also very frequent in these respiratory patients, so there's a lot of interactions between the two as well. So recent research from our group and also other groups, so Martin Paulus group for example, looked for the perception of dyspnea and the neural basis, and what we frequently observe is not only sensomotoric activations in the brain, but usually also these affect-related areas or also interoceptive-related areas such as the ACC, bilateral insula, or the amygdala. And this is of course not specific for the processing of dyspnea, but we find that also for the processing of other sensations that come from the inside of the body. This is an example, overlap between pain and dyspnea stimulation, but we see that also for other sensations such as thirst, hunger, and so on. These affect-related activations, they are assumed to play an important role for the later behavior of those patients, maladaptive behavior such as activity avoidance, which makes the course of disease probably quite worse in the long term. More recently, our group, as well as other groups, they have looked at what happens actually in the brain when the subjects anticipate upcoming dyspnea. And the interesting point here is that some of these affect-related areas are already activated during the mere anticipation of dyspnea. Again, insular cortex, ACC, and amygdala. It's a little small here. They are active if there's cue signaling upcoming dyspnea to these subjects. This is again something we also know from other aversive stimuli, for example monetary loss, aversive pictures. If these are anticipated, we have also similar brain activations. These anticipatory activations are especially prominent if the subjects are characterized by high levels of fear, more general fear reports related to the cues, but also if they report high levels of catastrophizing about dyspnea, or as in the example here of the Greifswald group, if they show high levels of fear of bodily symptoms. And we think that's not only the real perception of an aversive interoceptive stimuli like dyspnea, but also, and maybe even more important, the fearful anticipation of dyspnea, which heavily relates to the development of these maladaptive behavioral responses, which in the long end have an influence on a negative outcome in respiratory diseases in terms of muscle deconditioning and further decline in exercise capacity and ever more dyspnea over time, but also play an important role here on the other hand side for psychological disorders. That was the simple statement. Thanks for your interest.